Good Monday morning. It is January 24th. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook and on YouTube this morning. Coming up today, COVID hitting a lot of families hard, many struggling to keep food on the table. And for food banks, it's a struggle to keep shelves stocked for those families. We're going to talk with Stephen Davis. He is the Chief Operating Officer for Harvesters, the Community Food Network. Also, fewer people are donating blood as a result of COVID, and that has led one organization to declare a national blood crisis. So how are we doing here in the Metro? We're going to talk with Dr. Matthew Coleman, Regional Medical Director for the American Red Cross, and also Chelsea Smith. She is joining us from the Community Blood Center. Plus, our Chief Medical Officer, Dr. Steve Stites, is joining us here with how we are doing with this surge coming out of the weekend. So get your questions sent in on YouTube, Facebook, and the Medical News Network. You can find those links right there. Dr. Stites will get to you, but first let's get to our COVID count with Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson. Good morning to you.
Yeah, hi. Thank you. Yeah, I think it was either the end of last week or Saturday. I thought we had gone under 120 active infections. And what we are seeing nationally overall is we think maybe the peak or the decrease in case rates or case numbers. However, we know that there are communities and certain geographic regions that are still having high amounts of cases. We certainly have seen this now in our health system. Unfortunately, Steve, we are at 133 active infections, with 24 of those in the ICU, 16 of those on the ventilator, and 80 in that recovery period. So a total of 213 patients. But the other tragedy of this, as it continues and has been a tragedy since the pandemic began, is we had 9 inpatient deaths over the weekend, and overall total of 40 deaths in January.
Yeah, it's been a tough month, and it's been a tough ride here with the Omicron variant. I would like to believe that Omicron is less severe, and indeed, the percentage of ventilators in our hospital on this wave is much less as a percentage of the total number than it was before, and I say much less is about 30 to 40% less. So that's good news. The bad news is we continue to hit a record, and we're at 213. We've been riding that wave around the 200 mark now for about a week 10 days, and so I think what it says is we're seeing what we believe to be the peak of the spread here in Kansas City. At least we hope that that's true. We hope we're going to start doing what we're seeing nationally, which is some downturn of the data. Fauci's even said hopefully we're on the other side of the wave nationally, but that doesn't mean that regionally we are. And here's one of the challenges we face. We're so out of beds, we can't take all the transfers. And we know that as of the end of last week, wastewater testing was still going up in areas of rural Missouri, as opposed to starting to crest and plateau in the major urban areas. What that means is we should be taking a lot more patients from outside in rural areas of Kansas and Missouri than we can right now because we're full. And we heard earlier about the Mission Control app and the number of deaths that have happened in the emergency room. So what we see is the downstream effect from being full and having all these patients is that there are a lot of people throughout the area that aren't being able to get the help and the care that they need. And so that still remains a struggle. And 213 is still a big number. It's still a lot of deaths. And even though we can say Omicron is better, maybe it's not quite as bad as Delta, what we forget is Omicron is still bad. It's like, let's give 13 seconds to Patrick Mahomes and see what he could do to you. Don't give Omicron 13 seconds and see what they could do to you. Heck of a game last night, though. That was fun.
It was, and we'll talk more about that at the end of the show.
The Grim Reaper.
For sure.
That was a great thing. Don't let Omicron be your Grim Reaper. Don't give it 13 seconds.
Well said. All right, let's get to some reporter questions if we have any on the line. Okay, we don't, but I do have a couple for you. Kansas Reflector has a question. I realize off-label use of FDA-approved drugs for COVID-19 has been addressed in the past. Wondering if you guys could comment on this about these hearings Tuesday and Wednesday in the Kansas Senate on possible legislation that would allow Kansas doctors to prescribe such medications for COVID-19 without concern for disciplinary response from the licensing board. Tell us what that means.
Yeah, so this is just sort of messy. This is politics, unfortunately, and not healthcare. Yeah. And when politics gets involved in healthcare, it kind of gets a little messy. So if the drug is FDA authorized, as a physician, the drug is authorized, and you can try and use it for other conditions. That's what's called off-label use. Insurance companies are under no obligation to pay for the off-label use. And so if the drug's expensive, it sort of shortcuts that. In drugs that are not that expensive, you can write for an off-label use. The problem is that you're responsible for the outcome of that drug. And if you have that patient has a bad outcome, they can come back to you and say, hey, you had a bad outcome, I'm going to sue you, or you can get turned into the state board, et cetera. So when a drug's authorized, I can prescribe it even if it's not for its authorized indication, because the drug's authorized for the indication. But you can give it because the drug is also just plain authorized. What the Kansas legislation is trying to say is, well, look, if you want to use ivermectin for COVID, even though that's off-label use, and let's be honest, even though the overwhelming weight of scientific evidence says that it doesn't work and may even be harmful to you, because again, this is really a drug meant for parasites. What happens is that the Kansas legislature is now saying you can't be held responsible for any bad outcome. And I think, it's really bizarre to me that politicians, Hawkeye, want to move into the area of medicine. Essentially, the Kansas legislature wants to practice medicine for one drug. You can give this drug and not get sued. That's at some point, again, what we said before, you got to realize we're not each other. We're not the enemy here. The virus is the enemy. And if we would take the amount of effort into good infection control measures that we spend fighting with each other, we could get past this.
Yeah, I think it's a myopia. It's a myopia focused on masking optional. It's a myopia focused on one drug. When we understand that in society there are such great disparities, there is homelessness, there is violence, there is food inequities, there is healthcare inequities, and we are choosing to focus on this. It is a short-sighted myopia, and it's dangerous. I think if we are talking about ivermectin, you have to understand that those studies that did show benefit, most of those studies have been retracted for falsifying data. Those authors have been punished for that. When you actually do the review and the analysis of the other articles and research articles that don't have those biases, such as, again, falsifying data, misrepresenting data, there actually shows no benefit for ivermectin. And so I think it is important to understand that. We try to continue to promote the FDA, CDC, World Health Organization, and NIH recommended therapeutics because they have those trials, they show benefit. But if we are talking about ivermectin, again, really no benefit. In those trials that did not have a lot of bias, it showed really no benefit of using that drug. And just as you said, Steve, there is that potential for harm there as well.
All right, question from KCTV5 this morning. Missouri Attorney General points to an HHS study saying masks don't work. Can you help us understand? So if one says that masks work or don't work based on a limited data set in which schools were mostly closed.
Yeah, I think that the Missouri Attorney General is again playing politics and healthcare, and he ought to stay to laws or something. I mean, the idea that masks don't work, Hawkeye, is just it's so troublesome. We're still having that fight. Here in the healthcare system, we have been following and doing contact tracing for the entire length of this pandemic. We have our employees wear masks when they're in the hospital. We don't spread COVID in the hospital despite having 213 patients today. Yep. What we know is that when people are masked, we bend the curve, and when you don't get masked, you don't bend the curve. And I mean, the evidence is overwhelmingly clear. Instead of picking out retrospective studies without controls, without looking at variables that are important to evaluate and trying to pick and choose which study you want to find, as opposed to the overwhelming nature of studies, you can say that masks don't work, and it just hurts because people want to mismangle or mangle the data for their own political gain, and that's what this is. And the problem is, and we can see it now, is when you have 40% of your student body out or 40 or 50% of the teachers out, then, oh gosh, you can't hold school. And what we've said consistently is let's let kids get in school, but keep them safe while they're there so they can stay in school. Yeah. And the reality is that, yes, masking does work, Hawkeye.
Yeah, I'm going to push back on you just a little bit there,
Please.
Steve. I'm not sure it's picking out certain articles. I think it's just a inability to critically evaluate the numbers.
I'll give you that one.
To critically evaluate, to understand caveats. I think that's important. We've always been saying since the beginning of this pandemic, we need randomized controlled trials. Well, there was a great randomized controlled trial done in Bangladesh, published in Science, I believe, that showed that masking does work, that showed that surgical masks probably work better than those cloth masks that we've talked about, but that really put to rest the issue about do masks work or not work. You have to wear them consistently in those situations. In addition, I would also just like to point out a CDC study, MMWR, Morbidity and Mortality Weekly Report, published in September of 2021, so not that long ago. From where? St. Louis University. What did that show? When they looked at masking their students, they compared masked to unmasked, and those students who were unmasked had higher chances of exposure and infection compared to those students that were masked.
And
so
part of this whole argument,
Missouri.
Right, and again, part of this whole argument is that kids are really okay with Omicron or with COVID, and yet we just were on the phone last week with the folks at Children's talking about the high rate of Miss C. Hawkeye, you can deal with this, you can explain it better than I can, really, with Miss C in kids now with Omicron. An astonishing, a very concerning high rate, an alarmingly high rate.
Yeah, absolutely. And one of the things that we saw in another recent report from the CDC showing that 95% of these recent cases of Miss C were unvaccinated people as well. So I think its ability to understand, and understand who is telling you these things. Do they have the training to critically review studies, to critically analyze data and understand all the caveats associated with that? I'm not sure there are many AGs in the United States that are epidemiologists or physicians or trained PhDs in those certain statistics and numbers that I'm aware of. So.
It's interesting. So let's get it straight here. To stay in school and keep the teachers, the administration safe, and to keep the kids safe, what we're requesting is not some experimental therapy. We're not asking you to put your life at risk. We're not saying you ought to keep and bear arms. We're saying you ought to just put a mask on when you can't maintain distance of 6 feet inside. That's all we're saying. Just put a mask on for a few minutes while you're around folks. And that way you can stay in school and you keep your teachers safe, you keep your administrators safe, and keep the schools open, which is the right thing for the mental health of kids.
So I know we don't like to get political, but I'm glad you're both talking about this because this is why we have to, is when Attorney General puts out something like this. But this is from Eric Schmidt saying that some sort of analysis that was done shows that mask mandates are ineffective in schools and that non-mask districts fare the same or better than mask
to Hawkeye's
students.
point, he is subverting the science and the data and the information in these reports. And if we want to go back and do the study of masking in a randomized controlled fashion as opposed to let me pick and choose my facts, then what you're going to find is that masking, the evidence behind masking is so overwhelming. It is astonishing to me that at this point of the pandemic, we're still having to have that fight.
All right, we're going to get to community questions here in just a moment. But let's get to our guest. Dr. Hawkinson mentioned it. We've got a lot of issues going on, other things going on that we need to tend to here in our community. So joining us virtually this morning is Stephen Davis. He is Chief Operating Officer at Harvesters, the Community Food Network. Also glad to have Dr. Matthew Coleman, Regional Medical Director for the American Red Cross. And Chelsea Smith is back from the Community Blood Center. So good morning to all of you. So Chelsea, let's just get to it. Get us updated from Community Blood Center. Any good news?
Yes, some good news. We have seen a pretty positive response over the past few weeks. So 2022 is starting to look better so far. However, what we're needing to see is sustained increased donations. So we always see a bump in donations right after we go on emergency appeal, which we did here locally in December. So we saw that immediate bump in donations, and then the holidays happened, and then the surge hit its peak, and then hit another peak, and another peak, and another peak. So we've taken a lot of hits since we went on appeal, but we have slowly started to build up our blood supply again, and that's because we've seen an influx of donors. However, we don't usually see that sustained over a long period of time, and that's what we need to truly regain a stable blood supply. So at the end of the day, our blood supply remains unstable. We do remain significantly impacted by the national shortage as well. Oftentimes there can be regional shortages that might not affect the entire country, which means we can rely on a national surplus of blood, but we haven't had that for a long time. So right now we do need to keep this up. We need to keep seeing these numbers of donors in our door, but we need to see them coming back months and months and months from now. One significant loss that we've been sustaining since Christmas is blood drive cancellations as the Omicron surge hits our area. And several of those have been school blood drives, which is even more impactful to our blood supply because it's usually at high schools where students will donate blood for the first time. And unfortunately, we're going on 2 years now of a lot of blood drive cancellations that have happened on high school and college campuses. That is something that is probably going to impact our blood supply for years to come. We're missing generations of blood donors because of this pandemic. So some good news, but we really need that good news just to continue coming for the foreseeable future. Otherwise, our blood supply will remain unstable.
Yeah, Chelsea, I got my email last night saying I need to get in and donate. It's my time. It's my turn. What are you needing most? I know you don't turn anybody away, but anything in particular?
Yeah, we always need those typos. O-neg, as you know, is the universal blood type, which means everyone can receive it, which means that our emergency rooms go through that pretty extensively. What that means is that we are basically one big trauma, one snowstorm away from our blood supply, our O types being completely depleted just because of how quickly we go through that. So I've mentioned this before, but we're kind of still in that mode where as the blood comes in, it's going out immediately. A lot of times we can store blood, keep it on the shelves for several weeks if we need to, but right now that's not happening. If you donate blood today, it's likely that your unit is going to be transfused into a patient within a matter of days. It's a very quick turnaround in order for us to meet this need. And O-neg and O-pause are very high needs for us right now, as well as platelet donations. We're incredibly low on platelet donations. It's a different type of donation from whole blood and requires our donors to come into a donor center. And unfortunately, we've been low on those since the beginning of the pandemic and continue to see not enough donors.
Yeah, a little good news, but not enough. Not great. Let's bring in Dr. Matt Coleman. How are you doing at the Red Cross?
Well, actually, Jess, everything Chelsea just said for CBC applies to us at the Red Cross as well, unfortunately. We are in the midst of a shortage of blood that is unlike anything most of us have ever seen. Certainly more than we had ever hoped to face in our careers. It has been a challenge from the get-go, just as everyone on this call understands the challenges involved. We've been hit hard. As Chelsea was saying, any disruption in the supply chain has ripple effects. Unfortunately, with the American Red Cross being a national organization, any of those regional disturbances that may happen can have impacts throughout the entire country for us, instead of being confined to a local area. So that's one of the benefits / non-benefits of a national blood system that we have employed. So we too see critically low levels of almost all of our blood types, most importantly the type O's, as Chelsea was mentioning. But interestingly enough, as our hospital clients have worked very, very hard to conserve those type O units of blood, we've seen a disproportionate impact on our Group A and Group B blood supplies as well. And we now find that they, too, are critically short, which has been a new realm of this crisis that we're dealing with.
How does this affect hospitals and distribution? And Dr. Seitz, I want you to jump in on that as well. But Dr. Coleman, tell me a little bit about the distribution to hospitals.
Well, unfortunately, when the supply is not as large as it normally is, or that we would like it to be, distributions get curtailed. Hospitals get fewer blood products than they would traditionally want. And our goal is to provide them with the blood products that they need. Blood products have been curtailed in distributions around the country. Again, hopefully we're keeping up with the levels of what is required rather than where we'd like to be, which is what everyone would like to have.
Dr. Seitz, how does this affect patients?
Jess, here's the thing. These guys, the Community Blood Bank, the Red Cross, they've done such a amazing job over the years, and the American people do such a great job over the years of donating blood, that we in the hospitals, we're used to being able to order blood and just get it, right? And the struggle we have is that when you don't have blood, which you use to help save lives, what you end up doing is trying to maybe skirt the edge a little bit, or you try and use other things that you might have, like fluids, as opposed to blood products to help keep somebody's blood pressure up. What we end up doing, though, is we end up compromising care, because when you can't do the best thing and you try to do substitutes, then eventually that you don't get enough oxygen carrying ability in your blood, because what red blood cells do is they carry oxygen and distribute it around the rest of your body. And so when that happens, you end up in a situation where you could be doing damage to someone, and it's not that you want to, it's just when you don't have the blood products available, either you don't get enough oxygen out, or if you don't get enough platelets, you can't get the blood to stop, you can't get bleeding to stop, or for a variety of other things, because there's so many important things that come out of blood products that we have, that we use, that it is truly a life-sustaining therapy. And again, I think we've been so used to the high quality of the Red Cross and the Community Blood Bank have done for so many years at organizing blood drives and getting blood in and getting blood over to the hospitals, that it's not that we've been complacent, we've always been appreciative. We've just never faced a time like this outside of when there's a major crisis, like when the skywalk collapsed or whatever. We had lines around the 3 miles down the block trying to get blood at the Community Blood Bank. But now what we face in this age of COVID is people are a little fearful of going to get blood. We have to remember that it's incredibly safe. They do a great job. We need your help to go give blood, and to talk to your neighbors and all your friends to go give blood, because we really do need it. Otherwise, we compromise our ability to take care of people. And we've already had 40 deaths in January, 9 deaths over the weekend. And I'll just tell you, that's 40 deaths too many, and it's 40 deaths we didn't need to have. And why add to that if we can't get enough blood?
And you kind of mentioned it. I want to have you take a look at your screen, just kind of explaining why just why that day to day and having less blood on the shelves is so important. 50 units of blood needed for just one person who may be involved in a car crash. That's just one person, and then you look at how much is needed for one organ transplant, plus just people suffering burns. There's just a myriad of things that people need blood for, and these things
we
happen.
really
You
hope
can't
we don't
anticipate.
We hope we don't have to. Those are the kind of things you can run into, especially with
Right.
And some of our bone marrow transplants and leukemia patients. They take a lot of blood products, and so this is not something we want to do, and it really does save lives. And when we try substituting other blood stuff or other products, it just doesn't work. And so we just need everybody's help. We just need we need you to give a little.
Hey,
Please.
Chelsea. I understand you have a patient who was in need of blood. Can you tell us a little bit about her?
Yeah, we had a patient here locally that just in the middle of the pandemic, she needed blood transfusions and was treated here at a hospital in Kansas City. Katie Pino, she is a mom of two. She was actually in March of 2021 going into labor with her second baby, Tori, and unfortunately suffered a laceration in childbirth that resulted in a lot of bleeding. She received blood transfusions before she went into surgery and while she was in surgery, and she quite simply wouldn't be here without that. The blood not only sustained her long enough to get her to an OR room, but it helped her survive her surgery as well. And now she's, as you can see on the screen, a happy, healthy mom of two. She gets to continue being a wife and a mom today. And the reality of the situation is, if the blood hadn't been there for her when that had happened, immediately when that had happened, we might not be sharing her story with you today.
And we're just talking about a routine delivery.
Yes.
Bad things happen, and you don't expect them, you don't anticipate them, but actually you have to always anticipate and be ready. And you need, I just can't tell you, blood saves lives, and without it, we'll all be compromised.
Hey, Matt, I understand the American Red Cross has a big blood drive here in Kansas City, actually in Overland Park. If you don't mind, I'm going to tell folks about it. We're going to put some information up on your screen. And it's in honor of this young lady right here, Katie Scott. This is February 4th at the Overland Park Sheridan. There's the information right there on your screen. You can sign up to donate by going onto that website right there. You can use the sponsor code Katie Scott. Again, just another opportunity to give blood any way you can. And here it is, helping out in honor of this young lady right here. Dr. Coleman, you declared a national blood emergency. What does that mean? Tell me more.
Well, as we stated earlier, we have seen our blood supplies drop to unprecedentedly low levels, and has led to us declaring a national blood emergency. Basically, this is a step we haven't taken before, that we see regional disruptions, we see shortages in various places due to weather, due to disaster, due to various things. And what we're seeing now is that these combined disruptions are rolling up onto us for the entire country, and has led to us having less than 1 day's supply of blood, critically low for multiple blood types at multiple times. Has even led to us creating a new color for our color chart, where we used to use green, yellow, and red. We've had to create the color purple and place it below red to indicate that our supplies have slipped from very low to dangerously critically low.
And can I just ask
Certainly.
No, but so have you seen places where you can't supply blood and people are dying?
I don't have any firsthand knowledge that the lack of blood has caused a patient death. I can tell you that I field phone calls every day from hospitals, from clinicians, asking for additional blood products over and above what we have available for them.
Again, I think. Go ahead.
Sorry.
Please go ahead. No, you go ahead.
We've seen many efforts now to try to move patients. Several states have decided that it would be easier to move a patient from a rural location, perhaps that has an inadequate blood supply, to a larger hospital that has a better stocked blood supply. But as Dr. Stites has already mentioned, transfers are a very rare thing at this particular time.
Yeah, and I'll just say that, again, these guys do such great work that we always have what we need, right, historically. And so we're all grappling with a situation where we don't have what we need, and how do you substitute and do that? So it's hard to point when somebody's had a trauma and been in a car accident or bleeding from some bone marrow transplant or whatever. It's hard to say, well, they died because of that lack of blood. But the reality is that each of these things are they add up a little bit, and then eventually somebody isn't able to survive, and so we are really dependent on the blood supply, and kudos to the folks who give blood, kudos to the people who organize and deliver it, and like the community blood bank and the Red Cross. But ultimately, what we're going to need is more blood products. We're going to be able to continue to operate at a really high level of support for our patients.
Well, it's like that small kink in the chain.
Yeah, it only
along
takes
the way
one.
up. It makes a huge difference.
And people who need blood are generally very ill, right? You don't need blood because you're not sick. But the majority of people are really, really sick. And these little things, you can say, well, they got their unit of blood. Yeah, but they got it 6 hours late. In the meantime, you know, that all those organs were a little more ischemic. They didn't quite get enough blood, and the kidneys don't work quite as well. The liver didn't quite work as well. The lungs, the heart, and all that adds up, because in critical care, it's not one thing that makes you better. It's everything, and also, it's everything that makes you worse. And so it really does play a major role.
So I want to bring in Stephen Davis. He's the Chief Operating Officer at Harvesters. Good morning to you. Thanks for your patience. We've been talking about the need of blood. Equally important is the need of food in our community. I just want to put up some information on the screen as well, just to kind of put this into focus. It really speaks volumes. I think last month Harvesters gave out 30% more food than in all of December of 2019, which was right before the pandemic began. And a lot of those who received help were using the food bank for the very first time. Stephen, in the middle of a pandemic, it seems obvious, but just help us understand why we saw those high numbers and how you're handling that influx of people you're serving.
Well, thank you for having me. Just to give some context to the numbers, so December of 2019, we distributed about 4.6 million pounds of food. So a high amount of distribution even prior to the pandemic. But last month, we distributed 6.1 million pounds of food. So that 30% increase gives a little context as to how much food we're talking about. Our need remains high, as those numbers show. We're seeing a lot of increase that's remained during the pandemic. It's ebbed and flowed at different times. There's just been different federal programs. So the maximum SNAP benefits and extension of those SNAP benefits, the child tax credits, the extension of unemployment benefits, eviction moratorium. So all those things, as they've been implemented and then as they've now stopped, have certainly changed the amount of need that we've seen in the community, but it still remains very high, and our network reports that they're still serving a lot of people.
Stephen, explain to folks who may not know exactly what Harvesters does, how you serve people, how you get food to families.
Right. So we're the regional food bank. So a lot of times people hear of Harvesters, the community food network, and they think of a pantry that you might go into and get assistance. And we're a large logistical nonprofit, along with a variety of other things, where we collect and then distribute food in 26 counties. So in this region, 10 counties in Missouri, 16 counties in Kansas. And we work with a network of partners, about 800 partner agencies that are part of our network. Those are churches and nonprofits that receive food from us and then in turn care for their community. We also work with well over 300 schools that are either giving weekend feeding packs to children or school pantries in some cases, some mobiles in some cases. And so those distribution methods look like traditional pantries, like you're seeing on the screen now. They could look like mobile distributions, where it's a drive-through or walk-through distribution. And again, there are some in school settings. We even have some in medical settings.
What's it been like for schools? Schools, kids need food at schools way pre-pandemic. Now with schools closing sporadically, even now you can't even plan for it. What has that been looking like?
Well, I think the important thing for everybody to know is that children are disproportionately impacted by food insecurity. Food insecurity meaning you may have food today, but you're not sure if you'll have food tomorrow. So there's a scarcity of food and healthy food in particular. So our area has about 12% of the population, 323,000 people that are food insecure. So 12% of the total population. But children, it's 16% of the child population that are food insecure. So we know when, in particular last year when many schools were closed and needed to go virtual, which of course made sense for the pandemic, many of those children that were getting 2 meals a day at school, they might have been getting breakfast and lunch as part of the program, the National School Lunch and Breakfast Program, all of a sudden that went away. And so there was a lot of ways schools were trying to meet the needs of those children, a lot of ways that community organizations, nonprofits and churches and harvesters were trying to meet the needs of those children. But we know when schools are out, that is, and students might have to not be in the school setting, that's a loss of 1 or 2 meals a day, in particular those that are close or at the poverty level where they might be getting their regular supply of food.
Dr. Seitz, I know you have a lot that keeps you up at night. That is the thing that makes me put my head down and cry, just thinking that kids aren't getting fed at school and that there's any sort of disruption in distribution or people unable to volunteer.
Again, I go back to the opening of the program. We're fighting about something as simple about masks to make sure we actually get food to kids in school so they can have a good experience and they can be social and they can be healthy and do the things. Let's focus on the things that we clearly know make a difference, and getting food makes a difference, right? And so, maybe we're focused on the wrong thing too much.
Yeah. How's COVID affected the distribution, though, Stephen? And volunteers, are volunteers able to, I would imagine people who volunteer for you aren't going to let COVID stop them. They're going to do it safe. But how are you making sure people are staying safe?
We've been impacted a variety of ways. So you mentioned volunteers. So many people know Harvesters because they may have come and volunteered with us for a shift or multiple shifts. I mean, we are a nonprofit that relies heavily upon volunteer time. In normal times and pre-COVID times, that accounted for about 100 FTE for our organization. So accounted for 100 staff that we didn't have to have that people were donating time for. About 6,000 volunteers a month is what we need to pack back snacks, to pack senior boxes that are going to senior citizens, to sort and box food that we can send out to our partners, to sort produce. About 30% of the food we distribute is produce. And so sorting that, bagging that, so we can send that out to the community just takes time. And we're down to less than 50% of the volunteers we had pre-pandemic, which, part of that is us. We've reduced how many people we have at any given time so that we can socially distance. We have a lot of protocols that are still in place, though. We require masks. We ask everybody to do some pre-screening questions so that if they have any COVID symptoms, they're unable to volunteer that day. Obviously, if they have a fever, all of our staff and volunteers, as I said, have to wear masks. Agencies, when they come to the facility, they need to wear masks. But our distribution has been different as well. So the pantry model that you saw on the video, where individuals might be coming in and shopping, a lot of that has shifted to where it's now boxed or bagged and then handed out to individuals as they might be driving through more of a mobile distribution, or they'll limit how many people might come into the facility at any given time. Just sort of all those basic COVID protocols that we learned early on in the pandemic. Our network has shifted to ensure that we can still serve people this critical need, but do it in a safe way. And so that looks quite different across our service area. We had to dramatically increase the number of mobile distributions that we've done. We did 4 very large distributions in the metro area where we had well over 1,000 people that were served at one time, 2 of those at Arrowhead Stadium, and then 2 of those at other parts of the metro area. We were able to serve a lot of people all at one time, but try to do that in a way that limited contact, so it felt safe for those that were getting assistance and then safe for those that were serving their community.
Stephen, thank you for that. Stay right there. We're going to get to a few community questions because I know you've got to get going. Dr. Stites here in a few. Fonda has a question. If you have had COVID, can you still donate blood, or how soon after having COVID can you donate blood? Chelsea, I'll let you start.
Yeah, so if you've had COVID, you can donate blood. Right now, our regulation is still that we request you wait 14 days until after your symptoms have subsided. However, the CDC is constantly changing and updating those rules. So we are working internally to make sure that we're updating those as we can. Right now, it remains at 14 days for the community blood center. So 14 days post your last symptoms with COVID, please come in and donate.
Dr. Coleman, Elizabeth is curious, does the Red Cross or other services, do you do blood draws at home or in neighborhoods or any sort of mobile services?
We do offer mobile services. We have 2 types of mobile services. You'll see buses that drive around that set up at businesses, shopping centers, community resources, churches, things like that. In addition, we also offer inside setups in those areas that have large enough rooms to accommodate us. So yes, we do come as much as we can. Unfortunately, we do not come directly to homes yet. Perhaps that would be something that would be available in the future.
All right, Chelsea, Nancy wants to know if you can clear this up or clarify. This is specifically for you, but every time I donate blood, Chelsea, I get a notification that my blood is going somewhere out of state. If we're in such a shortage here, why would my blood be going somewhere else?
So we are part of the New York Blood Center enterprise. Pre-pandemic, we would resource share our blood with blood centers as needed. I'm surprised to hear that you're getting notifications that your blood is being shipped out, because we are not doing much of that these days. Most of our blood is going directly to our Kansas City hospitals. When we ship blood out, that is only when we have a surplus here locally. So when our local hospital needs are met and we have extra blood that we can supply other blood centers with, we will reach out, offer that assistance when we can. However, that's not happened very often since March of 2020, as we've been dealing with a shortage here locally. So as a community-based blood center, our local needs are our first priority. And then whatever surplus we have, we are able to extend help to other neighboring centers in states across the country.
Could it be that she has a rare blood type?
It's very possible. Yeah, if there are markers in her blood that set her apart from maybe others in her same blood type group, that's something that we track and that we're able to meet needs as that arises. So if there is a rarity to that individual's blood type, that could explain some of that as well.
All right. Stephen, a question from Derek. What is the absolute best way that we can help harvesters? Is it write a check? Is it bringing food there, dropping off at grocery stores, at bins? What is the absolute best way, quickest way to help you guys?
Right. So really all the above. You can purchase food and donate that to harvesters. Many of our area grocery stores, you'll notice, have blue barrels in the front of the store, and you're able to buy food and support a local business and then make that donation right there at the grocery store. You could drop that off at our Kansas City or our Topeka facility. We have distribution centers at both locations. As I mentioned, we have a lot of volunteer slots that are open. So we're down to less than 50% of the volunteers we had pre-pandemic. We have protocols in place to make it as safe as we can, and we welcome more volunteers to come back and volunteer with us, because we definitely need that help. And of course, financial donations are going to support this entire effort, including purchasing food, which we're doing a lot of that right now, and then making it available to the community. So any one of those three ways would be excellent ways to support us.
Dr. Coleman, Ruth is asking, are there any medications that would prohibit me from giving blood? And is there any information on a website I could go to? And Chelsea, let us know for Community Blood Center as well.
Unfortunately, yes, there are some medications that will preclude you from donating blood. Most of those have to do with either forms of cancer therapy or related to things like blood thinners, anticoagulants, things of that nature, that we don't want patients to receive through the blood. There are a list of those that are available through the redcrossblood.org website. We keep that list updated with current FDA, wrong agency, sorry. Current FDA guidelines about which drugs are included in that and which are not. It's not a very long list. It's certainly not as long as it used to be, and that is a wonderful thing.
Dr. Coleman, I say FDA and CDC, and I get them all mixed up all the time on here. So.
It's government alphabet soup. You know what I'm saying?
It really is.
There's the AG, there's the
yeah, believe me,
FDA,
we need
CDC.
We have a tough time keeping them straight. Chelsea, I have a couple of COVID questions for our doctors. Did you have anything to add about that real quick?
No, not really. Just to say that a lot of people assume that if you're on medication of any type, that you're ineligible to donate. And the reality of the situation is that there are very few medications that would prevent somebody from being able to donate. So we also have a list on our website at savealifenow.org. And I think I speak for both myself and Matthew when we say, please don't defer yourself and don't assume that you aren't eligible to donate, because you very well might be eligible despite what medications you're on.
Is there an age limit? Joellen is curious, is there an age limit?
Yes, there is an age limit. For the Community Blood Center, we require 16-year-olds to have parental permission in order to donate. And then 17 years and up can come in and donate anytime.
But you're never too old, right?
Nope, we do not have an upper age limit, so it's
okay.
Yeah, that was the right answer, Chelsea, right there. That was the right answer. You're
Dr.
never
Stites,
too old.
You're up. Okay, and just real quick, Emily.
Close.
So, Stephen, really quick, and I had the same question for harvesters. Are there any certain foods? What are the top? Give me quick top few foods if people are going to go out and buy and bring down to you. What do you need?
Certainly food that's non-perishable is always in high demand. So, and also if you're thinking about children and what they need. So we're always looking for a meal type food. So soups or peanut butter, or certainly always fruits and vegetables, because we want to make sure we distribute healthy food. So any of those non-perishable items are great foods to distribute. I also would just say, look at yourself and your family. What does your family eat? And that's probably a good indication of the kinds of things you'd want to look at and donate.
Can I just say that peanut butter is actually a food group for itself, because I love peanut butter. And as a child, I had a lot of peanut butter jelly sandwiches, and I loved those.
No, that's the best. That's the key staple. I love that.
Yeah.
Okay, so that's questions for our guests. I'm just going to ask one question from Deb, and then you're back tomorrow, right?
Yes, ma'am. I
You
think
are. So we'll get to a bunch more of our COVID questions because I know you all have them. But Deb wants to know, are these the highest, the worst numbers we've seen since the start of this pandemic?
Yeah, they are. This is the highest hospitalization number we've done. I was actually hoping last week we had hit 204, we got down to 196. I thought, okay, we're trending down. Then we bounced up to 213 over the weekend. Now, there's a lot of things we have to remember. These numbers are all pretty similar. Sometimes Sunday's not a big discharge day, but overall it's the trend we don't want to see. I mean, I don't, cross my fingers, I'm going to look dumb here, but I'm going to say, I don't think we're going to hit 300. I'm going to hope we don't hit 250. I'm going to hope that numbers are going to start to turn and go down here by the end of the week, Hawk.
Yeah, I would agree with you. And again, I think we go back to the inpatient deaths just over the weekend, 9 deaths, 40 total for January. These are not people who just came in for a broken leg or a trauma or are found incidentally to have COVID-19. These are deaths from COVID. And there are also 2 very good news studies from the CDC showing that being up to date, especially in those ages 40 to 59 and 60 and above, if you are up to date on your vaccinations with that booster, that third dose, really after 5 or 6 months from the second dose, you are better protected against hospitalization, severe disease, and death.
And then just to say, just for those of you who say, well, Omicron's not as bad, it's just cold. Remember that it's cold if you've been heavily vaccinated, including your booster shot. Clearly, boosters are important. But also remember that these 19 deaths are increasingly going to be pointing towards Omicron deaths. These are not still Delta deaths because these patients came in, and it is true. Our length of stay is down a couple of days, which is Omicron. The percentage of ventilators is down, that's Omicron. But the reality is the deaths are still going up, and that's Omicron. So don't get cocky.
So you brought this up, so I have to ask. Pamela's saying with all those deaths, it seems like this is a worse variant than Delta.
Well, I don't know about worse. They're just all bad. And I think we're so tied up into saying, well, is it worse than the original variant? Is it the Alpha variant? Is it the Delta variant? Is it this?
It doesn't matter.
It's just, as Aka keeps saying, it's COVID.
Yeah.
And COVID's bad. Quit acting cocky. It's bad.
I think they do all fall under the same umbrella of really causing the same symptoms, the same pathology. But we do know vaccination attenuates that severity. It decreases that severity. It does decrease your risk of hospitalization. Even if you've only had those 2 doses, you still have a decreased risk. However, the decrease in that risk is greater if you are up to date and have that boost, especially if you are in those older ages.
It's fun to call Patrick Mahomes the Grim Reaper. That was a great game last night. We had a lot of fun. 13 seconds left. Go be the Grim Reaper and all that and stuff. That's great. The problem is that in real life, football's not real life. Football is real life, but in life, COVID is the Grim Reaper, right? And at some level, you can say, well, Omicron's not as bad, except if you die. And here's the key, guys. These are unnecessary deaths. No one has to die from COVID-19, or very, very few. Because if you get vaccinated and you get boosted and you wear your mask when you're around a bunch of people. I wore my mask at the game last night. Okay, well, there weren't a lot of us, but the reality is that I'm going to be 62 years old really soon. I want to be 62. I want to be 63. I want to be 65. I want to be 70. And what we know is that COVID-19 doesn't discriminate. It doesn't care if you're Republican or Democrat, right? It doesn't care if you think it's really bad or not. COVID really is the Grim Reaper, so don't get reaped here.
All right, we're going to get to final thoughts. And I'm going to go ahead and start with you, Chelsea. And on that note, Jill wants to know, are there weight restrictions for blood donation?
Yes, there are weight restrictions. It does depend on age and gender. But in general, 110 pounds is the overall limit. And then when you get younger, teenagers, we do require a little bit of a higher weight restriction. But overall, 110 pounds is that weight restriction.
All right, final thoughts. And where can we donate?
Yeah, final thoughts. Trauma and illness exist outside of COVID, and they always will. Unfortunately, we are very significantly impacted by what happens with the pandemic. So we've mentioned this before, when we see surges like this, donations stop coming in. And quite simply, that can't continue. We are adding additional strain to our already strained healthcare system by not having a stable blood supply. And the only answer to that is for blood donors to come in and to consistently keep coming in, to make a habit of donating blood so that we do have a stable supply when there are traumas and illnesses outside of COVID-19. I know that this message is maybe fatiguing some, and that you've been hearing us say this for a long time, but we quite simply can't get out of this without blood donors. So just would ask that here locally, if you could go online to savealifenow.org, you can find a list of donor centers and blood drives near you, and ask that you come find us and make an immediate donation, and then keep coming back.
Dr. Coleman, final thoughts.
To extend what Chelsea said, we ask for patience and persistence. There may not be a drive this week or next week that you can get to, or that has an open slot for you. Please, in that case, be persistent, be patient. A donation that you give in 3 or 4 weeks or 2 or 4 months is just as life-saving, is just as necessary as one that you make next week. This crisis is here to stay for a few more weeks, at least, unfortunately. So as we bring people out and ask them to donate and thank them for their donations, we ask that they persist. As Chelsea mentioned, please give as soon as you can, and please come back as often as you can.
Thank you so much, Dr. Coleman, for joining us. Stephen, final thoughts.
I have 3 final thoughts. The first is I just ask everybody to give voice to the issue of hunger. It is in our region, in our 26 counties, as I mentioned, 323,000 people that are food insecure. So these are not strangers. These are your family members. These are your neighbors. These are your children. These are friends of your children. These are the seniors that are living in our community. We all know somebody or multiple people possibly, or we may have been or are food insecure. So this is a community-wide issue, and we certainly want that to be lifted up and people to know that it exists. The second thing is, if you're inspired about the work that our network of partners do and the work that we do, there's really 3 ways to get involved. You can donate your time, which we welcome more volunteers. You can go to our website and conveniently sign up. You can donate food. As we've mentioned, you could do that locally at many area grocery stores where we have our blue bins, or you could bring those donations to either our Kansas City or Topeka location, and you can donate money, which you can safely and securely donate that online, or you could always send in your donation. And then finally, as this program is always dedicated to, we just ask everybody to take all the measures that's been lifted up throughout this entire program and series of programs, and do what you can to control the spread of COVID. That is certainly increased the amount of people that are food insecure, and the more that we can control the spread of COVID, the more we can control the number of people that are negatively impacted by the results of COVID.
Yep, Stephen, it all rolls downhill. Thank you so much for sharing this information with us today. We will get out and donate. Doc Hawk, final thoughts.
I think our guests are correct and spot on. I just want to echo, we know there are so many more issues. We know that there are issues of food inequality and homelessness and violence. And I think it's important to focus on those and other disparities that are truly problems in our community, rather than focusing on medicines that don't work or masking that does work. I think we need to focus on those other things that can keep people safe and healthy, and that's very much the way to go. Keep those in the forefront of our thoughts as well, and focus our energies on those types of things.
Last words?
Here's how I see it. These are all folks who are experts in their field, right? They have no hidden agenda. You watched Patrick Mahomes last night. Sam Mellinger, the former star writer, called him the ultimate cheat code. Never out of a game. He proves it over and over. He's incredible at his craft. The Chiefs are incredible as a team. They have no hidden agenda. They're just trying to win. When it comes to folks like our infectious disease team with Hawkeye, or with our physicians here, there's no hidden agenda. These are nursing staff, no hidden agenda. We're just here to try and help you get better. Beware of politicians looking for votes. and instead remember what we're all here for. And what I would say to all of you is that we have tried to say to you from the beginning of this program, from the very first day, we're not going to flapjack. We're not going to flap our arms and jack with the truth. We're just going to tell it to you the way it is. Because like Patrick Mahomes, like the Community Blood Bank, like the Red Cross, like Harvesters, we got no hidden agenda. We just want you to survive the virus. Remember, COVID is the enemy, not each other.
Thank you. And thank you all for being with us today. Don't forget you can catch our show anytime by logging on to our Facebook or our YouTube channel. Coming up tomorrow, the COVID surge is not only leaving store shelves empty and blood bank supplies low, this also includes much needed prescription medicine. We'll take a look at that, how the surge is impacting surgeries and procedures. We'll talk more about that tomorrow at 8 o'clock. Everyone have a fantastic Monday. We'll see you then.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.